Hi everyone, and welcome to this webinar on real scarring, real results, how to effectively treat C-section and hysterectomy scarring in women. So this webinar, we will be the webinar, sorry, will be presented by Hannah Poulton, amazing women's health physio and leading scar specialist. So thank you so much for those who are joining us live. If you do have any questions, please feel free to submit them into the Q&A tab. We will try our best to get those answered at the end of the presentation. We do have some pre-submitted questions, so thank you all for those, and we will be making our way through those as well after Hannah's amazing presentation. If we don't get around to any of the questions, we will send some responses to you all. So we will make sure that any questions do come through. We will be sending some answers your way. So, okay, I think we're ready to hand over to Hannah.
Lovely. Katie, thank you so much. And before we get started, thank you so much to PhysiQuip for allowing me to do this webinar. Scarring is something that I am deeply passionate about, and how to effectively treat scarring is also something that I'm deeply passionate about and want to share with as many people as possible. So before we get started, and before I speak about who I am, let's just have a quick look at some facts and figures. So women make up at least 51% of the world's population. And of course, we live for longer than men, and we spend a longer time being ill. So we take up more hospital beds and GP appointments. However, the vast quantity of health research is carried out on men and then translated to women, which of course we have completely different chemical makeups than men, and different compounds in terms of properties within our bodies that are significantly different from men. Now, this presentation focuses on C-sections and hysterectomies. Within my clinic, we treat a lot of C-sections, and the hysterectomy scarring is on the rise as well. And it's interesting that the C-sections within the UK, the government has now taken the cap from hospitals. So instead of keeping around that 20% or lower, now it is a woman's choice that she can have a C-section birth, and for many other reasons as well. And this has had a dramatic rise on C-section births within the UK. At the moment, it's 1 in 4 of all births. However, the World Health Organization, WHO, predict that 1 in 3 births will be C-section births by 2030. And I want to make a bold statement saying, I think we're fast approaching that figure very soon, within the next couple of years. C-sections are on the increase for a variety of reasons, but where is the aftercare? And where is the scar recovery aftercare for such major abdominal surgery? And this is why myself and PhysiQuip are designing webinars like this, educational courses to educate and empower health and fitness professionals and clinicians within how to fully assess and treat scarring, because it's going to be you guys that are listening to this that will be the first on the scene asking these clients, so how does your scar feel? How does that impact your range of movement? Does a C-section scar affect your pelvic floor? Absolutely. And we're going to be looking at all of that later on in the webinar. So hysterectomy scarring, we talk about the menopause and the aging population in the media. The hysterectomy scarring seems to be a scar that has been forgotten about. You will have a significant scar depending on the type of hysterectomy you have had. And of course, if it's 55,000 hysterectomy operations carried out within the UK each year, which relates to about 1 in 5 women. And the most common age is between that 40 to 50. However, a lot of hysterectomy surgeries are carried out outside this age group. And with similar to the C-sections, where is the advice? Where is the support? And where is that scar rehab information? This is why it's up to us to be fully trained, fully prepared, and deliver the best scar therapy for our clients. And of course, it's not just about the scar, isn't it? You have to look at that holistic person. And we're going to be talking about that so much within this webinar. So let's get cracking. The aims of today's session, we're going to be looking at, so I'm going to tell you who I am and what is HLP therapy and why it came into existence. We're going to be looking at what scar therapy is, different types of scars, outcome measures, treatment protocols, very quick video demonstrations of me with a LymphoTouch device and how I use that as part of a holistic assessment for scar rehab. We're going to be looking at before and after photos. If you follow me across my social media pages, you will probably have seen a lot of these across my social media pages, but we're going to be exploring them in slightly more detail. And we're going to be looking at that all-important follow-on plan, how that client can take forward their scar therapy themselves in between seeing you. And then we're going to have a good session at the end for lots of Q&As. And Katie will interrupt me as needed as part of the webinar as well. So who am I? My name is Hannah Poulton. I'm a highly experienced physiotherapist. I started my physiotherapy journey in 2001, 2002. And I have progressed through the ranks, being a junior physio in medicine, progressing to be a senior physio in medicine and in neurology, and then the clinical lead for physio as part of our local hospice, which is where my oncology background comes from and how I'm deeply passionate as well about women's health and breast cancer scarring in particular, and also where I started my original scar therapy. Many years ago. I have a fantastic team of women who work with me. You'll see them here. Kirsty's my practice manager. Charlotte is a very experienced women's health and pelvic health specialist. And Leanne is my amazing massage therapist who, without her, goodness, I don't know where we'd all be. We all use her services from time to time. I work in this lovely grade listed building where HLP therapy is based. And we have beautiful clinics inside there, and it is a joy and a privilege to work from such a glorious location right in the centre of Leicester. The reason why I started my journey with scar therapy while I was interested is because of not just Charles and Camilla. They are my two children. But when I was telling them that I was doing this presentation, they said they wanted to choose their photo. That was the photo that they chose that they wanted to display. It's because of my passion for physiotherapy. And then having my children, who are now 10 and 6 respectively, and the traumas that I faced after my first vaginal birth. I had 3rd-degree tears. This had to be repaired later and involved reconstruction surgery a year later. And having a miscarriage, which resulted in surgery, then having a C-section birth myself with my second son. And then having lots of bowel issues and hernias which needed surgery. It was because of all of this surgery in a very short space of time, so over a 6-year period, that not one professional asked, "Oh goodness, Hannah, those scars look severe. Those look tight. They look painful. How do you feel about them? How does it impact you?" Nobody asked, and I was in a lot of pain, and coupled with my physiotherapy background, I'd moved into oncology at that point. I started looking at my client scars, my patient scars, and starting to ask the question, you know, how do you feel about your scars? And the resounding response was, oh, nobody's ever asked me about that. And through that, through doing courses with amazing individuals, learning, developing my own techniques, using these techniques in clinical practice, doing more courses, developing my own courses, I started to look into scarring and how, using my physiotherapy, using my acupuncture skills, using my women's health knowledge, using my physio skills, taping skills, scar therapy skills, to start to effectively treat scarring, and of course using the best medical devices as part of that treatment. If you follow me, you will know that I own HLP therapy, and also the positive C-section. I'm also the co-founder of Everything Natal, with a phenomenal women's health physio who's been doing this for about 22 years. So I love working with Sarah Norris. She is amazing. Highly respected in her field, and together we are teaching health and fitness professionals about postnatal concerns and assessments, and of course the pelvic floor. So if you want to know more about that, then please head over to the Everything Natal website. So after that introduction, let's get on to what we're talking about today. So what is scar therapy? What are we actually doing when we are touching a scar and a patient's scar? Well, we like to use this fancy word, mechanotransduction. It basically means an external force which is creating an internal change or response. So that means just touching the skin. You will know when somebody touches you in a nice way, how that produces endorphins and how the scar feels and the tissues feel and where you've been touched. And also when somebody touches you, you know, aggressively or knocks you by accident, how that also creates a physical response. So scar therapy has the ability to create this internal change under the scar to enhance scar recovery in a very gentle and positive way. And what are we doing? We are influencing those cellular structures, remodeling, helping that remodeling phase, which we know a scar takes 2 years to reach maturity. And after that 4 to 6 week period, that remodeling phase is really underway, unless obviously the scar has had setbacks with infections and delayed healing. We are changing and influencing those tissues under the surface. With any operation, especially C-sections and hysterectomies, your nerve endings are involved. They're cut, they're damaged as part of that surgery. And nerves grow at an alarmingly slow rate, so 1 millimeter every few weeks. And of course, it's this stimulation of us touching, engaging, enhancing that scar recovery also has that positive impact on nerve regeneration as well. As you know, and bringing in my neurological background, as you know, all your body parts are represented on your homunculus, on your brain. And you will know when you knock your elbow, for example, or stub your toe, you don't have to physically look at your elbow or your toe to know the body part that's been affected. In surgery, you can get this numbness round the scar, spreading throughout the tissues round the surgery incision site. And of course, if you don't engage with that scar, if you don't touch that scar, if you don't have a normal response to sensations around that scar, the area can feel numb for a long time. You don't have that same stimulus as you would when you knock your elbow or knock your toe, because you have a normal response from those areas if they've not been affected from surgery. So we need to really start to enhance that neural pathway in a really controlled way. With that gentle release and touching of the scar, you're going to get endorphin release, aren't you? You're going to be stimulating those mechanoreceptors, those sensory receptors of the skin in order to create change. And what is our end goal? Well, if you have a very highly oversensitive scar, we want to desensitize that area. We want to enhance that appearance of the scar. We want to relax the tissues, soften the tissues, create a better improved blood flow to that area. And of course, we will have a huge impact on the emotional and psychological effects for that client when we are enhancing their scar. We talk about scars, and this is really important. We talk about the physical, we talk about the chemical reactions, but those emotional responses to a scar are so important. And I do believe we cannot treat the physical unless we acknowledge and treat the emotional and psychological effect of scarring as well. Now, I talk from a physiotherapy background. I'm mental health first aid trained. I'm not a counsellor, and I make that quite clear. But once you start with scar therapy, start talking about the scars, start touching the scars, you will see this release from clients that they want to potentially open up and talk about their journey with you. And I say that I'm not a counsellor, but what I am, I can listen, I can empathise, I can understand parts of that journey, possibly because I've been through similar myself. And I believe that is key to really effectively treating scarring when you look at that emotional and physical response as well. I also work with a great counsellor, and I refer lots of my clients, when appropriate to do so, on for counselling, because it's super important that we address those psychological needs. So scar massage, what is it? It's a series of light, gentle, massage-based techniques that we do with our hands first and foremost. And the tools, your hands are so important, and you get so much feedback, don't you? As manual clinicians, as we are, you get so much feedback from your hands. We don't want to lose those manual techniques. 6 to 8 weeks post-op, we're breaking the bonds between the scars and the fascial connections. We're going to be talking about later on how we treat those keloid scars very differently from hypertrophic scars or flatline scars, and how we treat them with care. The use of medical devices and products is always an adjunct to your manual therapy skills. You never treat alone with a device. It has to come with a full assessment and then your practical hands-on skills. And of course, scar therapy is easy to teach clients, isn't it? They can go away with a rehab plan and self-scar massage plan, and they can carry on the treatment in between you seeing them. And of course, it's all about holistic treatment, looking at the whole person. So very briefly, we're going to have a whistle-stop tour of the common scars that you are most likely to see. So flatline, white, atrophic, flatline scars are, the gold standard of scars. This is what everyone wants. Hardly visible. It doesn't look like it's puckering, pulling. Now, interestingly enough, I have a huge percentage of clients that come to me with scars like this, because on the surface it's healed great, but underneath you get that pulling, that tightness, that restriction, those adhesions, especially in C-section and hysterectomy scarring, where many scars can adhere to bladder, bowels, pelvic floor because of where the scar is. So just because this is a lovely white atrophic flatline scar doesn't mean that it won't come with a series of internal problems. You might then see a hypertrophic scar, which is where the body has laid down collagen within the scar line, so within that scar border, creating this raised approach to scarring. And it looks like a red line, a bootlace, a slug across the top of the scar. Now, I love these scars. 50% of all scars become hypertrophic. So you're probably going to get a hypertrophic scar very frequently coming into your clinic. And we're going to be talking about how we can treat those in just a moment. And of course, keloid scars. You'll see here, this client sent me lots of images of how her keloid scar has changed with the treatment that we've provided on this C-section scar. And also with a keloid scar, one of our amazing clients as well. Now, keloid scar is when the body produces collagen on top of collagen, just like a hypertrophic, but the difference is with keloid, then the scar grows beyond the scar border. So you get this widening of the scar with collagen production on top of collagen production. Keloid scars are the most common in darker skin if you have a family history or a genetic disposition for keloid scars. And of course, they are the hardest and trickiest to treat and take the longest time to recover. Now, you can see on this photo the difference the keloid scars we have made, and we're going to talk about how to treat that later on. Very quickly, you cannot be treating scars on a regular basis without using some kind of outcome measure to assess how effective your treatments are. Now, your outcome measure, it will be dependent on your profession, what's relevant to you, and also what's relevant to the client. So I use a combination of outcome measures as part of my assessments and part of the research projects that I'm involved with, and we can talk about more of them at a later date. So your visual analog scale, you will know you'll have that 0, no pain, 10, worst pain that you've ever felt in your life. Or you can adapt that to how does your scar affect you? 0, not very much. 10, it affects everything as part of my daily activities. And you can document this within your notes, asking the same question on multiple sessions as the client comes to see you, in order to gauge where they are in their recovery journey. Now, I also use the breast Q and the scar Q. You have the links here on this presentation. You actually have to request this so they know who is using it. It's a recognized and validated outcome measure. It's predominantly started from children, and it's worked up with adults and burns and highly traumatic scarring. And it has 3 independent functioning scales that measure the appearance of the scar, the symptoms that the client treats, and also that psychosocial and psychological impact of the scar. I use the scar Q numerous times to plot and to assess how my client is progressing. And this is imperative to get those real results, because on the surface, the scar might not have changed very much. And we'll talk about photographs in just a minute, but actually the psychological effect of their client might have progressed, and also what they're feeling might have progressed. And it's imperative that you're documenting this in your notes to give weight and evidence to how your treatment is progressing. You can also use the SOAS, which is the Patient Observer and Scar Assessment Scale. And this also looks at, the scar characteristics, the color changes, what the client is feeling, and also what you as a clinician is seeing. The SOAS has been updated, so make sure that you're getting the updated version, and please go onto their website and download the updated version if that is an outcome measure that you want to use. I also use photographs and tape measures to measure the scar and to plot the client's journey, and then attach these to my clinical notes. I use an online note system, so it's very easy to do that and keep track of clients' progress from a very visual point of view. And we would use photos, obviously, if the client allows. I have a permissions form that every client fills in before I take photos, and they're stored in relation to ICO guidelines. And of course, it gives the client feedback as well on, oh, look how my scar has changed. It's less red. Oh, I didn't realize it was that thick. Oh, I didn't realize it looked like that. And it gives them some hope and encouragement of how their scar is changing and how they are changing. But of course, photographs only tell half a story, don't they? Now, the scar that you can see here, this lady had a huge hematoma under her C-section scar. It took ages to treat. She was sending me photos of how it's changing, an abscess formed. And then, of course, 6 months later, you get a photo like this. Photos are great for visualization, especially on social media if you want to promote what you're doing, but also there's no timeline here. There's no assessment of the psychological effects of this scar. And of course, there's no looking at, what treatment we've provided. And of course, I use a tape measure because the scar can change. It can look shorter. It can look like it's changed in terms of the length and the color. And I use a little tape measure that has a color chart on it. And I document where they are in their color chart from a scale of 1 to 7, and it's great for your own documentation. What does that tell the client? Not a lot, but for your own documentation, you can see then how the scar is changing. I do believe this is imperative to getting real effective results when we're documenting and collecting data and using valid and reliable outcome measures. Now, treatment protocols. This is imperative to getting the best results. You need a full assessment of that client. So we're talking in this webinar about C-sections and hysterectomies. So what does that mean? So we do a full consultation, asking all the red flag questions, bladder and bowel dysfunction. We're talking about past medical history, what medication they're on, and any other surgeries they've had. We're talking about how the scar impacts them on a physical and emotional and psychological level. We're using an outcome measure as part of that. And of course, then we're assessing their range of movement, how they stand, their posture, their breathing, spinal extension, spinal flexion, lateral side bends, to see, does the scar restrict? Does it impact their movement? Are they saying that's painful? Are they tight? And you are looking at how that scar is moving and functioning as a client is moving. We squat, bend, lift, raise our arms in everyday life. It's important that we fully assess the client before we look at the scar. With C-sections and hysterectomies, I'm talking from a physiotherapy point of view. I clear above and below the scar. So we look at diaphragmatic breathing. We look at rib angles and rib flare. We look at, how their position and posture is in standing, and also their pelvic floor. As a women's health physio, I can conduct internal assessments where it's required. And of course, I want to know about pelvic floor function, bladder, bowel, how this has impacted them post C-section and hysterectomy, because that has a huge effect on a client if you're struggling with bladder and bowel dysfunction, and then of course you're recovering from a huge surgery. The impact of that and the fascial connections from your pelvic floor linking into your abdominals, and then of course where you're cut with that surgery has a huge impact on that scar recovery. I know I only have 10 minutes left of the presentation, so I'm going to whip through this last section. We're going to be checking that there is no infection, there's no stitches, there's no staples. The consultant is happy if applicable, and the client is happy for you to engage with scar therapy treatment. And we're going to select the right outcome measure for that client. If they're highly distressed, then I'm not going to spend a long time on a huge scar Q outcome measure. It might be that a VAS outcome measure is appropriate for that client. If you have a client that is happy to chat and talk and wants to share with you and happy to answer questions, it might be that you choose an outcome measure that is a little bit more robust for that time. We're going to look at scar protocols now, products as well to support your recovery, and of course devices that will help. So with that flat line atrophic white scar, you want that full history, you want your assessment moving, you want, as a women's health physio, I check diastasis recti, and you want to check that because of course if you have a significant or an impactful diastasis, that's going to impact how the scar pulls, looks, heals. The overhang, that all-important overhang, we're going to be talking about how to effectively treat that, I think, in the questions at the end. And it's going to affect that tension along the scar because of the abdominal strength and also the underlying pressure as well through the abdominals if that diastasis is not effectively working, or if those abdominals, sorry, are not effectively working. With all of your scars, you're going to be looking at pulling, restrictions, tethering, adhesions, tightness, stretch marks around the area, moles, fragile skin, dehydration of the tissues. Any of the surgeries, you will know yourself, you'll ask the past medical questions and they'll go, no, not had any past medical history. You look at their abdominals and you see all these keyhole surgery marks. Oh yes, just a small surgical. Oh, it was, years ago now. That will have a massive impact still of how those small, insignificant, what people think surgeries can play a huge part in how the scar tethers, links up and adheres under the surface. So what do I say? We're going to start with that light, feather-like touch over the top, assessing the skin, assessing the tissues. We're going to be looking at slide and glide with our fingers, that bracing and smudging. I talk about all these techniques across my social media and YouTube page. With flatline scars, we can do rolling, we can do circles. And the LymphaTouch is exceptional at you getting in there with the tight scars underneath for these flatline scars. So you start at 90 milligrams of mercury in your first session and you build it up. 10 minutes, you can progress to 150. As the client allows. Protocols are very subjective in terms of the client that you're treating. So you can progress, how I find, quite quickly with flatline scars with the LymphaTouch device, and you can progress up to 350 if you have the sports mode and that small treatment head. And I use a video to show you how that works just a bit. Very, very quickly, because I know that we are now pushed for time, that hypertrophic scar. So where the body's laying down collagen on top of collagen, always think about what are you trying to treat. I'm not in the aesthetics business. I'm not here to just make a scar look pretty. I'm interested in that function, that feeling, what is going on under the scar. So the same start, that full history, that assessment, the same start of building up, that touching with that scar. And I want to use very similar techniques on hypertrophic, working directly on the scar and directly across the side of the scar, trying to blend that scar and soften and release the tight tissues around it. Of course, things like myofascial release, absolutely fantastic if you're a myofascial expert or do release. Absolutely, around your hips, around up into your diaphragm, releasing tight, stuck diaphragms is absolutely imperative. If you're a physio and there's issues with the pelvic floor, then pelvic floor release, absolutely working on that, using that holistic approach around the scar in order to release that tightness and tissues and that sticking around the scar and that tightness as well. Really, really important. And the LymphaTouch on this, I work directly over the scar with it and across the side of the scar, blending and softening that scar. And of course, core exercises, a rehab plan and a self-scar massage plan, so important. Keloid scars such as this, and you can see the results here and how effective they are. You have to be super careful with keloid scars. We don't want to stimulate that collagen production where you're making the scar grow or become excessively worse and multiply. Now, I use the LymphoTouch with care on this. I use gentle massage techniques directly on top of the scar, really purposeful scar manual techniques over the scar with direct pressure. You don't want to be stimulating around the scar and stimulating this collagen lay down. So I very slowly start with a LymphoTouch device in order to try and break the tightness that a keloid can cause within the scar tissues, and build up very, very gently from 90 milligrams of mercury, possibly on the first session, to possibly 100 on the next, and always watching the tissues to see how they respond. You want to see softening, blood flow and relaxing of the tissues. What you don't want to see is that the tissues start to become even tighter and start that collagen production. The gold standard for keloid scars is that silicone plus that mild compression, and what I believe is hands-on treatment and devices that support that reduction in keloid scarring. Now, of course, we do midline incisions. You can have these for C-sections and for hysterectomy, depending on what type of scar, what type of surgery you have had. And you can see some gentle changes of flattening of the scar here. This was in 2 treatments with my client. And the same again with midline incisions, working around the scar, fascial release, using your hands, sliding, glide, bracing and smudging circles, bringing those tissues together, using the LymphoTouch device as part of your manual treatment. And if it's a midline incision, if it's an atrophic or hypertrophic, you can use those same protocols for that. And keloid scarring, use the same protocols with care. Looking at scar rehab plans, core work, and pelvic health and pelvic floor work. The LymphoTouch is great to incorporate into your treatment because, of course, you can use the LymphoTouch head as you would do your manual scar massage techniques. So sliding and gliding across the scar as you would with your hands, circling across the scar as you would with your hands, zigzagging across the scar. We can press and lift the LymphoTouch device to get more of an increase in that interstitial space, and I'll show you that on the videos, to create more of that lymphatic flow and blood circulation as well. Imperative to scar healing. And of course, you can use the pulse and continuous method on the LymphoTouch device to control how you're using it in scarring. Now, very quickly, I would always start off the scar with your LymphoTouch device. Make sure you have oil or cream on the skin so it's soft and the device flows. You don't have to keep lifting the device on and off the scar. What you can do is start off the scar, so on the tummy, around the hips, find those areas of tightness, and then as the client tolerates this device, you can then start working on the scar itself. In the next video, you will see me quickly working over the scar. There's oil on the skin. I keep the head on the scar. You hold round the seal, not on the white treatment head, and to get a better purchase between you and the scar itself. And you can work from left to right across the scar. You don't have to take the LymphoTouch off. You can use that sliding and gliding approach as the tissues are being lifted. You get this pumping action and releasing of those tight tissues across the scar. And you'll see that I carry this on and do this again, and you're constantly checking in with the client, constantly seeing how they are feeling about the treatment, and increasing the treatment time as allowed. Normally I would be holding the tissues as I'm using this, but of course I'm filming with my hand while I'm doing this, so I don't have another pair of hands, which would be helpful. But I hold and brace above and below the scar, and then use the treatment head up and down over the scar in that zigzag formation across the scar. You can use this on those flatline scars, which I'm using here. This is a double C-section and hysterectomy scar, which is over nearly 15 years old, but still causing the client pain. And you can use this on hypertrophic and white line scars, not on keloid scars, because we don't want to be frictioning that scar. Okay, and then with atrophic scars and with hypertrophic scars, you can do this really funky thing with the LymphoTouch, and I absolutely love it. That small treatment head, you can get into those tight scars, those keyhole surgery scars, absolutely fantastic, and working within the scar. And then what you can do is, going across the scar, you can do this lift and pull across the scar. You won't be able to recreate this with your hands. This is purely the device that can do this. And you'll see there the increase in blood flow. You're on 350. You wait for the click on, so it engages, lifts the tissues, and then you lift the device, creating this even bigger interstitial space on how the blood flow then circulates underneath the scar. And you can see the redness that comes straight to the surface of the scar. Clients love this. I get great results from this. As I've said, I'm also an acupuncturist and scarist, and a scar therapist, and tape, and I do taping, and I use this combination of acupuncture, taping, the LymphoTouch device, and manual scar therapy to get great results. Now, we have completely run out of time, and I want to answer all your questions, so I'm going to give you a montage of photos in 10 seconds, Katie. I hope that's okay. Before and after photos here of a very traumatic C-section. You can see the difference in changes, texture, pulling of this hypertrophic scar. This scar faded dramatically, and you can see it's less bumpy, less red, less raised. Here we were using silicone, we were using the LymphoTouch device, we were using Naki oils to help start to blend, fade, and change the scar texture. The overhang, which we're going to answer in the questions in a moment, was dramatically improved by using a combination of treatments: core rehab, hydration, ergonomic changes in terms of sitting at your desk and postural support, scar rehab, nutrition, and silicone, and the LymphoTouch device. We've already seen how this keloid scar has changed with the LymphoTouch device, with silicone, with manual therapies. The same here in this tricky hypertrophic, hypersensitive, which of course you can't see that on the screen, but the difference in terms of the dates, you know, a couple of months, the difference you can make. And of course, it's not just C-sections and hysterectomy. We go from scars like this to this, which is my clients that I'm treating currently, that's had multiple pelvic fractures. We go from this at the top, chemo-induced shutdown and damage to nerves and tissues and the blood transport. And the difference, the LymphoTouch has been instrumental in making these changes to this client. Lateral hysterectomy scar, which has changed, massive improvements in terms of function, appearance, range of movement, skin quality for this breast cancer lady. And the same here, the LymphoTouch actually helped open up this older scar hair, and the lady said, "Oh, you've got rid of my Cornish pasty," which is what she effectively knew it as. But under here it was tight. She had like fluff and stuff from clothes, like it embedded in the scar, which we're able to clean out, and very dramatically soften this scar. So within the last 10 seconds, how to effectively treat scarring in a nutshell. You need to have great, obviously, assessment skills, treatment skills, selecting the right products and devices, and using the LymphoTouch as part of your treatment when appropriate. You need to be looking at a scar rehab plan for the client so they are empowered and they can carry on their treatment when they're not with you. You need to look at good nutrition, proteins, nuts, pulses, your omegas 3 and 6, which you don't produce yourself. You have to take them on board to help with that scar recovery. Protein is that building blocks of cellular activity for scar regeneration. We need to be looking at our clients' nutrition. Hydration. If your tissues are hydrated, they're not going to slide and glide. You're not going to be hydrated yourself. So important. Posture, pelvic floor work, core activation, ergonomics of them, what they do in everyday life. Are they sitting down at a desk? That's going to increase that intra-abdominal pressure. We need to be looking at that. Let's get them moving. Let's get them stronger. Let's look at those stress levels. We want to decrease that cortisol. It's going to have a massive impact on their scar recovery. And that emotional connection to the scar. And last but not least, engaging with that client so they are empowered, they're knowledgeable, they know what they're doing, they know what you're trying to do, and get them on board in terms of really affecting their scar recovery. So very quickly, I run one-to-one courses where you can come and spend a day with me in my clinic. We have sold out for this year, so we're looking at booking into 2024 already, and we treat scars all day, all together. Absolutely phenomenal. Follow me on social media. You will get a whole wealth of information that's free and at your fingertips. If you look at YouTube, type in scar recovery or HLP therapy, you'll see all my videos on scarring. And today, for this webinar only, I have an online course on how to treat scars effectively. 22 videos and counting, because I'm always constantly updating it and making it better for you. Normally £249. You have lifetime access today and until the end of July. If you would like it for £149, please email me and we will sort that out for you. Katie, any questions? Thank you so much for listening, everyone. Thank you, thank you, thank you. You can tell this is a passion of mine, and I am so excited to be able to share this with you. Thank you for listening. Thank you, PhysiQuip. Right, questions, Katie, fire away.
That was jam-packed full of amazing information, honestly. Yeah, really appreciate that. I'm sure that everyone has taken lots of snippets of knowledge away from that. So yeah, amazing. So we are going to try and get through as many questions, but we are short on time. As I said, we will be sending responses over to these questions following the session. So if we do miss your question, don't panic. We will be sending some answers to you to help you guys out. So the first lot of bits of questions, the pre-submitted ones, we'll go through first. So there was a lot of questions surrounding treatment over granulated keloid scars, which you have covered, and hopefully that has helped a lot of people out. Do you still approach treatment for these scars at the 6 to 8 weeks post?
Yes, I do. Yes, I do, is the want of a better word, as long as they're obviously not still open, there's no infections, there's no stitches and staples, that's those same contraindications, and the client is happy for you to treat them. You need to be super gentle, you need to take your time. Keloid scars are going to take potentially the longest times to see those difference, so you need to prepare your client that it's a long journey, it's not just a quick fix. And of course, for keloid, the silicone is great if appropriate. I always work with, their GP's practice as well. If I think there's anything that they might need a blood test, that actually they might have an infection, writing a letter and getting them in to see their GP, working in conjunction with their GP or with their consultant, especially if I feel there are any significant changes with that scar that I'm not happy about, that's out of normal behaviour for scar recovery. So yes, treat keloid scars and treat them with care.
Yeah. And do you treat these types of scars any different when they are intravaginal scars?
So yes, so being a women's health physio, I can do internal pelvic floor assessments and work. I wouldn't use the lymphatouch internally. Manual techniques I do currently at the moment, although we've just purchased a device looking at stimulating a weaker pelvic floor. which we're going to be launching very soon. Internal scar massage, we do that in clinic, and then we teach the client how to do self internal scar massage as well. Same again, gentle, direct approach over the scars as the client can tolerate, building up the time. It might be 5 to 10 minutes first of all for them to do it themselves daily, going from 10 to 15 minutes, and then possibly a little bit longer as the scar is changing. Obviously, always work within your scope of practice, and always treat these internal scars with care, because they have dramatic impacts, as we know, on bladder and bowel function, on intimacy, and of course on pain and pelvic floor. So we look at the pelvis as a whole. So yes, treat them with manual techniques. I don't use any other devices. I use lubricants and products to help internal scarring as well, and always treat with care and take your time.
Amazing. We have a question about the frequency of manual treatment making a difference. Is this dependent on the age of the scar, for example?
Yeah, absolutely. And also your caseload, isn't it? I have an 8-week waiting list, and it's really difficult to see people as frequently as I would like. And you might be listening and having the same problem yourself, which you are. I'm really pleased about. What a great problem to have. However, if you're having a really new scar, so that's 6 weeks, and you want to see them on a weekly basis, what I normally say with those early scars, you're going to be seeing lots of really quick changes. So I would see them potentially every week for the first 4 to 6 weeks, and then start to lengthen that time. So you might see them 4 times within the first 4 weeks, and then you'll go to every 2 weeks, every 3 weeks, every 4 weeks, and so on. Older scars are going to take longer to change, aren't they? You're going to have those changes. They're going to be slower. It might be that you want to do the same, that quick succession in treatment once every week for the first 4 to 6 weeks. But you might want to carry that on for a little bit longer, or you actually might want to treat them and then develop a really good program where the client is treating themselves, and space it out for a couple of weeks, and then 2 weeks, 3 weeks, 4 weeks, as they start progressing. Unfortunately, I see my clients once and then I can't see them for about 4 weeks, which of course does create an impact on scar recovery and the quickness. However, because I use the devices and products and do a good scar rehab plan, they do have really good outcomes. There's no one set rule. Every client with a scar is going to be different, and it's your clinical judgment on how you want to treat them and see how that scar is changing.
Great, no, that's great, thank you. So we have a question. Do you think there is a strong place for visceral mobilization with clients with C-section scars?
Yes, absolutely, 100%. And this is why I can't live without my massage therapist who does this. She's just amazing. And if you do visceral mobilization or fascial release or any kind of body works, then oh my goodness, yes, what you do is fantastic. Like I said in the presentation, you cannot treat the scar in isolation. If you've got that really tight diaphragm, there's no engagement with that breathing, they've got tightness around the hips, into the lower back, into the pelvic floor, absolutely. Viscerally, fascial releasing work, body work, absolutely. Use your toolbox, just like myself, my neuro background, my acupuncture, my taping, my oncology, all together to treat the scar. You'll probably have treated scars without really knowing it for many years. It's just now focusing on some simple treatment techniques for scars. But yes, by all means, love visceral mobilization.
Okay, amazing, fab. So we have a couple of questions that have come through about sort of the use of silicone gels, patches. Obviously, the first question is, are you using them, which
Yes.
you can cover, but then is there any recommendations?
Yeah.
And then there was a live question as well, sort of similar to this, with regards to all those different modalities and products and creams, and what sort of evidence are there behind them out there, and do you know of anything, or is
Yes.
there
Yes.
the gap there?
Well, on the end of this presentation, and you'll have quite a few references for scarring and outcome measures and the role of manual therapy and scars. And you know what, it's sketchy. There's no getting away from that. More research needs to be done, and hence that's why I'm embarking in multiple research studies, which I am super excited about. So watch this space for more information on that, and how we're going to change the face of scar recovery with this information. And it's sketchy. Please have a look at the reference list that I've sent you. Please have a look at what's out there. We need to get better at doing our outcome measures and collecting data on scar recovery, because we know it works. We know it works in clinical practice. And a lot of the evidence I'm talking to you about is because of what I've been doing in clinical practice. And so really, really important. But just because the evidence isn't there doesn't mean that we should stop doing it. We need more better research to keep promoting what we're doing already. And regarding products, yes, I use silicone. That is the gold standard in international scar guidelines for hypertrophic and keloid scars. I use Scarban. They are on my product page on my shop, on my website, which is www.hlp-therapy.co.uk/shop. So you'll be able to see that. I also use Juzo products, which is Juzo. They have a range of German-made silicone, which I use for my hysterectomy scars. And of course, I use the Naki gels, which is NAQI. I just had an email half an hour before this presentation started. They've changed their branding because I wanted them pink and I wanted them all girly to part of my C-section kits, and they've finally changed it, which is great. And they're going to launch a whole new pink project range, which I'm very excited about very shortly. And the Naki range contains that omegas 3 and 6, which your body doesn't naturally produce, which helps with scar healing, moisturizing the scar. I use them, and I use them from 4 weeks post C-section hysterectomy scarring. That's the repair oil, and then the skin optimizing oil from 6 weeks plus. And I also use Alhydran, and this is very expensive but very good in terms of the research and evidence behind it. It has aloe vera, jojoba oil and vitamin E, and it acts as a humectant, which means it not only just drops through the layers of the tissues, it creates a barrier over the top of the scar and draws up fluid from healthy tissue right underneath. And that's really impressive on scars and scar healing. I do believe it's imperative that we get used to using these products within our treatments, because our hands alone, devices alone, are not going to achieve those results as quickly as potentially possible unless we start looking at other areas as well.
Yeah,
Yeah,
absolutely. Thank you. And I think Jill was just asking, with regards to lotions, creams that you use, the Lymphatouch, you use the Naki and the
yes, and the Alhydran.
Yeah.
And also if you have facial scars, because I know the Lymphatouch is great for facial scars, I would get a cream. I use BAP, so BAP scar cream, and also the Naki silicone touch. It's a silicone within a cream that you can sweep over the scar, that has very similar properties to a silicone strip to lock in that body's moisture and that scar moisture. It's a transdermal water loss barrier. And you can use that over your face. So you sweep it on, it dries, so it's clear, so you can wear makeup over it as well, which is really good. But yes, the oil, I use basic oil, I use Naki oil to have that slide and glide effect of the Lymphatouch over the scars.
Amazing. We had quite a few bits of lymph touch questions through, which we will sort of responses over to everyone who has asked about the lymph touch. There was a particular question about using lymph touch for edema management at an earlier stage, surroundings of C-section scars or hysterectomy scars. Is that something that you are doing with regards to the edema approach rather than treating directly on the scar?
Yes, so like I said in the first video, you work off the scar first of all and then approach the scar after you've built up that time, that tolerance, and the client's happy. Be careful with edema because you need to be sure of where it's coming from. So is that an infection? Is that an abscess? Is there something going on underneath the surface? Is it stuck? Is it tight? Always check in, with their consultant, their GP, making sure that, that it is safe, first of all, to treat the scarring. So yes, once you know that it's safe to treat and you're okay to treat, absolutely. Edema management, of course, the LymphoTouch device was first of all created, wasn't it, for that lymphatic drainage, lymphedema management of arms, etc. I find the LymphoTouch highly effective with breast scarring when lymph nodes have been removed and you do have that lymphedema buildup. So yes, I do it. I work in conjunction with the patient, the breast care nurses and the consultants, and start off lightly, always lightly, and build up your treatment time and the pressures accordingly.
Yeah, I'm going to sum up with just two last bits of questions.
Yes, of course.
So one is a little bit tricky maybe, but what difference are we doing using devices, other products, technology within sort of scar therapy rather than our hands? What would your opinion be on that?
Yes, and not a tricky question at all, a great question. There are thousands of manual therapists out there that are making huge differences without having to use devices and products. Absolutely. My point is, you want to, in today's day and age, you want to effectively treat scarring as quickly as possible. And people want results. They want results if they're paying good money. They want results quickly, don't they? They want to see the changes. They want to feel how it's changing underneath the surface. And I believe mechanical devices such as the LymphoTouch are excellent as a conjunction with your manual therapy. So you cannot physically lift the tissues and create the same flow as what the LymphoTouch device does without causing the patient some severe discomfort. The LymphoTouch is very effective in separating, opening up those tissues and creating that flow, which I think as manual therapists that we just cannot do that. So I do believe a combination of the LymphoTouch and of your manual skills and of the products, so the client can have the treatment delivered between sessions, with silicone and with gels and creams, and they're getting good quality research-based creams and gels, I believe makes a huge difference. It's all in conjunction together, working together, using products together can only benefit the client. That's all we want, to benefit the client.
Yeah, amazing.
Yes, next question. One last question.
One last question. And so there was a few questions around sort of about approximation on seeing results. How do you meet expectations of your scar patients? This is something we get a lot. I guess you did mention about scar therapy. Every scar is different. Everyone's response is different. How do you manage those expectations with what changes that patient is going to get at what stage? How do you communicate that? And yeah, like I say, is that very different to everyone?
Yes, well, I think that is an amazing question. Thank you to everyone who's asked it. What we need to be aware, and what you'll find across all my social media, and what I say is, I never say we get rid of the scar. I never say we're going to take away the scar, we're going to remove it, anything like that. It is vitally important, and I say this at the start of all my consultations with my clients, your scar is a scar for life. We are never going to take that away, but what we can do is help with that function and feeling of the scar. So if you have a client that scar is tight and pulls, yes, I can functionally help with that. And in that process, you might experience aesthetic changes, but I'm not an aesthetic specialist. I'm a physio first and foremost, and your changes to your scar are varied. They might not be as exactly as you want. It will change over time. It takes 2 years for a scar to reach maturity. You've got plenty of time within that time to make a huge difference. But I make it very clear at the beginning, we're not removing the scar. And that's why your outcome measures and assessment and documentation is absolutely vital. That you are sharing correct information with your clients right from the get-go. Really important. And I know one question was about the overhang as well. This is the number one thing that women, especially when we're talking about C-sections and hysterectomy, want to treat. And the overhang is a combination of multiple factors. Predominantly, if you have diastasis recti, the abdominal separation, we need to get those abdominals working effectively. It has a direct impact on how the scar pins in, looks, feels, and pulls. Hydration, if you're dehydrated, you're not going to get the sliding and gliding of tissues. Really important that we get that client hydrated. Nutrition, if they're overweight, if you've got that huge overhang and then rubbing of the skin and the tissues underneath there, and you've got skin breakdown, you've got to be looking at that first. Getting air to those areas around the scar, looking at supports which may help, looking at creams, powders to help dry up the area. We've got to be looking at that first of all before we're even touching the scar. It also, the overhang is affected on the scar. If the scar is super tight, if you cannot touch or look or feel your scar, then we've got to start that process of softening and engaging with that scar to create that unity within the body. I have a YouTube video on overhang and how to treat it. It's on my YouTube page. I'll be posting it on Instagram this week because it's always the number one thing clients ask. I always say, and feel free to use this expression, it's the first thing to appear and the last thing to go. So stick with it.
Sum up.
Exactly.
Oh, thank you so much. We have run up slightly, so we'll end it there, and we will, like I say, send some responses to you all if any questions that we've managed not to get through. So thank you everyone for joining us this afternoon, and I hope you enjoyed the session. Thank you, Hannah, so much for your time, your expertise. It's very much appreciated. I think this was a valuable session to a lot of people. So following this, we'll be sending out a bit of a survey along with some details about the discount for what Hannah's running for you guys who attended the webinar on the Scars Online course. We've got plenty of other previous webinars and bits of videos Hannah's done for us in our academy as well, along with Hannah's YouTube. So definitely lots more information elsewhere as well to review over. So thank you so much, Hannah. I'll let you go and have some lunch.
Yes. Sounds good. On to the next meeting.
Yeah, that's more like it. But yeah, thanks again, and yeah, see you later.
See you later. Thank you everyone for joining. All the best.
Bye.
Bye.